Hello, everyone. I just wanted to introduce myself. I'm Fuad Al Bash. I go by Bash. I'm one of the medical students.
And he's going to be speaking tonight. We can go ahead and get started. Bosch, I made you co-host, so you should be able to share your screen now.
Okay.
So thank you for joining us. Thank you everyone for joining. So we have Bosch tonight, and like he said, he is a medical student here in Cleveland at the Clinic South Point campus. He is going to be talking to us or with us about just some techniques that help with our pain, like the benefits of yoga, meditation, and mindfulness. So it's kind of extending what we were talking about last month with Dr. Sarah at Inspired Chiropractic and Wellness, just some different, more natural techniques to help us with our pain. A couple of announcements, I think, maybe just one. So Ariel and Kevin, if I'm missing anything, please jump in. But we did send out another Google form for more grocery card gift cards. So if you have not filled that out and would like a $50 gift card, it's on our Facebook page and it's on or in the email that I sent out about this meeting. But if you need it again, let us know and we'll get that to you. We are asking that it's just one person per household. We're doing this for a few different months until money runs out. So we want to get as many people as possible, many households as possible with the gift cards. Am I forgetting anything? LEAP is doing another emergency preparedness webinar series. I believe it's a 3-part webinar, but they could have restructured it a little bit. That information is on our Facebook page again. But if you need me to send it to you, then let me know. Otherwise, we will just let Bosch take it away.
So, hi again. I'm Bash, one of the medical students. I go to Ohio University Medical School, and my campus is in Cleveland Clinic South Point. It's a pleasure for me to be with you guys, and thank you very much for this opportunity. So in this presentation, I'm gonna be talking about like pain management and what other factors that can affect pain, like psychological factors and other environmental factors. So I'm gonna be talking about the definition of pain, how the body and the brain responds to pain, the psychological condition that affect pain, self-managing pain, and the effect of some techniques that can help us with the pain management. So scientifically talking, pain is the definition of pain is it's an unpleasant sensory and emotional experience um, that is associated with actual or potential tissue damage or described in such terms. The function of it is to signal danger to the body if something is going wrong. That means the body it needs attention. So how does the body respond to pain? Mostly by the nervous system. It starts by feeling of alarm, apprehension, and stress. There's an increased reactivity of the body by increasing muscle tension, increased heart rate, blood pressure, GI reactivity, and other systemic activities. There's also increased cognitive focus on the danger, in this case, increased tendency to worry about it and catastrophize it, which is increased anxiety. So avoidance behaviors such as guarding, resting, staying at home, and not engaging in activities can actually exacerbate and increase pain. So it's very important for us like to know how is that happening and what are some cofactors that can make the pain worse. So areas of the brain activated by pain, multiple studies showed that uh, anxiety, depression, PTSD, fibromyalgia, and some other psychological conditions, they affect the brain the same area as the pain affect the brain. So they do share the same regions. Mostly they are the amygdala, the hypothalamus, and the anterior cingulate gyrus. Most of these regulate emotions in general and stress responses. So researchers have noted that people who have poorly regulated response to stress are also more sensitive to pain. Psychological conditions such as anxiety, which is the most common condition that accompanies chronic pain. People with anxiety, as I just said, depression, PTSD, and other psychological medical conditions tend to perceive pain at lower pressure and experience more severe and long lasting pain than other people. Thus, pain can become particularly intense and more harder to treat. So, what are the benefits of treating and keeping an eye on these psychological conditions? Um, it can minimize the pain and help the patient perceive pain in a different way. So, for instance, like exercising, doing yoga, um, any kind of activity that makes our heart increase our heart rate can actually increase the endorphin release in our brain, which help with the pain, anxiety, depression. So that's why they say like it's very important to stay physically active. Um, if someone is just feeling down, he doesn't have energy, so the mnemonic for depression are SIG ECAP. The S it stands for sleep disturbance. The I it stands for lose interest in the stuff we like to do. The G is guilt. We're always feeling guilt. The E, SIG ECAP. The E is for lack of energy. The C is poor concentration. The A is like poor appetite. P is for psychomotor. So like we might have muscle tension, like muscle spasmic. Some people they might have uh, like focal seizures. And at the end, the S is for suicidal ideation. So basically, what's happening with depression, it's telling us all of the time, like, okay, stay in bed, don't do anything. Um, like everything is, all of the negative vibes are coming to your mind. But like if we say, okay, like depression, like get the heck out of here, like I don't want to anymore. If for 1 second we just put the idea in our mind to go outside, like do any kind of physical activity. I'm not just talking about being physically active. I'm talking about like drawing, singing, reading, joking around like with people, with your loved ones, laughing, spending time with your relatives, with your friends, having new goals, having new fulfillments. Those are very important and help us actually like get out of the depression or the anxiety stage or any kind of psychological condition. So that's why it's very important to know like all of these factors. And with the managing of these factors, our pain can be perceived in a different way and at higher tolerance. So yeah, sleeping well, eating healthy, having a healthy lifestyle in general is very important. Food plays a big major role in this as well. Uh, like we should try to eat more vegetables, more fruits, food with like more vitamins, vitamin D, vitamin B complexes. Um, in general, those would really help with any psychological condition. So self-managing pain, it should start like whenever we want to start like self-managing pain, we should have these uh, five kind of factors in our mind. Like we should accept that we have the pain because some people tend to have the pain as normal. They can it's just like natural with them. They can't like perceive it. That it has to be with them all the time, so they can't do anything. So we have to accept that we have the pain. Many people they stop fighting to rid themselves out of pain, so they just make peace with their pain. Empowerment, which is allows people to take back control of their pain and lives. Self-confidence, to no longer be alarmed by pain and no longer hold the opinion that pain must be reduced at all costs. um, See that it is possible to live with pain, and pain is not the center of our lives. Self-esteem, in which we overcome the sense of alarm and know that it doesn't have to be avoided. Good coping skills, quite possibly the most powerful intervention based on many researches, which say that we have to be able to reduce pain and improve our function. It allows us to be more engaged in life. So some psychotherapy, and most of these psychotherapies, they're done by either psychologists or psychotherapists or psychiatrists. Some people they can actually do self psychotherapies if they have the experience. CBT, cognitive behavioral therapy, it, it doesn't only help with anxiety, depression, but it can also help with pain, treating pain. It mostly teaches us how to learn coping skills so that we can manage the pain rather than be victimized by our pain. Patients might attempt to participate in activities in order to improve function and distract themselves from focusing on the pain. Just like how I said, like if we ever felt that there's like pain or like we're feeling down or we can't control it, let's for just like 1 second think, okay, like I don't want to think about it. I have it, but like I'm gonna do something else to not think about it. Just like how I said, like anything can help, like reading, listening to music, singing, drawing. If you like to drive, be physically active if you can. Um, some other techniques are relaxation training. Various techniques can help people to relax and reduce the stress response, which tend to exacerbate pain as well symptoms for anxiety and depression. So techniques include progressive muscle relaxation, yoga, and mindfulness training. Hypnosis. During this therapy, a clinician helps a patient achieve a trance-like state and then provides positive suggestions. For instance, that pain will improve. Some patients can also learn self-hypnosis. So why yoga? Why yoga is very important, not just like for pain, for like even just like relaxation, mental state. It encompasses meditation, relaxation, breathing control, and a variety of postures. Yoga practices suggest that they can reduce the impact of exaggerated stress responses and may be helpful for both anxiety and depression. Hence, by controlling these two factors, people who have pain can minimize and perceive pain in a minimal way. So, this page basically talks about evidence-based literature, which mostly focused on research. One study showed that three groups were subjected to more or less painful thumbnail pressure. The participants with fibromyalgia, as expected, perceived pain at lower pressure levels compared to other subjects. The MRI showed that they also had the greatest activities in areas of the brain associated with the pain response. In contrast, the yoga practitioners had the highest pain tolerance and lowest pain-related brain activity during the MRI. So the study underscored the value of techniques such as yoga that can help a person regulate their stress, therefore pain responses. But for many patients dealing with depression, anxiety, or stress, yoga may be a very appealing way to better manage our symptoms. Indeed, the scientific study of yoga demonstrates that mental and physical health are not just closely allied, but are essentially equivalent. So many types of yoga are practiced, but like the two most one based on my research that I did that can be helpful for patients with spinal cord injuries and people who have uh, anxiety, depression, and low threshold for pain are the hatha yoga and the Iyengar yoga. So the Hatha yoga is the most common type of yoga practice. It combines physical poses, controlled breathing practices, and short period of deep relaxation or meditation. Um, the Iyengar yoga, it's another type of yoga mostly practiced by the spinal cord injuries. I was trying to look up for resources in the region of Cleveland, Ohio, and Ohio for these. I'm not sure if there are specific ones that are like for spinal cord injury specific instructors, but like most of my researches, it says that there are like physical therapists and other rehabilitation specialists that help with this technique. Um, so yeah, that's the type of yoga. Mindfulness is another technique practice which can also help us with any psychological medical condition. So as individuals with spinal cord injuries are encouraged to look inside and concentrate on their breathing during the yoga practice, they become aware of deep and positive mind-body experience. The therapeutic focus here is an outcome of improved functional activity. Breathwork mindfulness on health course can offer numerous psychological benefits to people with spinal cord injury. For patients with spinal cord injury, mindfulness was effective in reducing symptoms of depression, anxiety, pain unpleasantness, and pain catastrophizing. Excellent. So those are resources from YouTube. Uh, I'm gonna try to see if we can actually watch watch at least like one of them. Okay, I don't know if it's gonna work. In case it didn't work, I can send these to Megan, and she can send them to you. Those are very helpful to see. Um, you don't have to do everything while practicing. I think it's work. So, are you guys able to see? No. Okay. Okay. For some reason, it's not. Oh, okay. There you go. I'm sorry about this. I'm not the best using technology. It's working. Okay. So, Okay. So just by doing like these kind of activities, that's an aerobic exercise. We're actually triggering our brain um, we're triggering our brain to not think about the pain, to perceive pain in a different way. But like if we were thinking all the time about like pain, anxiety, or depression, that gonna actually makes it worse, and that's gonna exacerbate our condition. But if we were doing anything else, if we were like uh, just kind of making our mind busy with something else, that would definitely help uh, with lowering the pain. So those are like some stuff. And there's another one. Uh, okay, share. Okay, there's another. I can send these links to Megan, and then she can send them to you. Those are really helpful to see and to practice on your own. You can definitely do it on your own. Okay. So those are tips from the National Center on Health, Physical Activity, and Disability on their website. It's a very helpful website. I would recommend everyone to go and look it up. They do have multiple tips, uh, not just for they do have like good tips for healthy lifestyle in general. So some of the ones I really liked is to stay socially active by having a pen pal to keep in touch with peers, staff who would normally be seen every day. So you take advantage of FaceTime, Facebook, the technology, and other social media forms to connect with family, friends, best friends, and your loved ones. Exercise your mind. Try to play board games, word games, trivia, read, listen to books, listen to music, anything that interests you. Try to find some, if you like reading but like you don't like certain topics, try to find some interesting topics for you that you can read. That would definitely help. Stay physically active by playing outdoor activities, games, practicing life skills activities such as sweeping, vacuuming, doing laundry, or following exercises videos. Incorporate an activity that brings happiness or peace, which is good for mental and emotional health. It can be following meditation videos, rocking in a rocking chair, spending time with pets, as well as sensory based activities. Surround yourself with positive people. It's very important to have a good support system in your life. So again, not just like to treat the pain, but like to treat the uh, anxiety and depression. Medications definitely help, but it's very important to have a good support system in your life, uh, especially like being around your loved ones and people who have positive vibes all the time. Other treatments for pain, as we all know, they can be like medications, radio frequency ablations. Radio frequency ablation, it's a new technique with people who have like discogenic back pain, mechanical back pain, like or herniated disc. Um, Basically, what we're doing, we go into the nerve in the spinal cord, and we kind of cauterizing the nerve. It's called medial branch nerve, which mostly its main function is to perceive pain. So for a lot of people, the radio frequency ablation has showed positive results in controlling pain. Epidural nerve blocks, it's kind of the same idea, but like we're basically injecting steroid or anesthetics in the spinal cord. It depends for people, like if they tend to have pain radiating from their back to their legs, or like numbness, tingling, or other central pain. Spinal cord stimulators, those are also this is a minor surgery done by either orthopedic or pain management doctors or interventional specialists. And the main purpose of this, um, it kind of give another stimulus. So like if someone is having like a leg pain, for example, the pain is going like onto the brain, then it's going back to the leg. What the spinal cord stimulator is doing, it's kind of giving another stimulus, which which interfere with the pain stimulus, and in that way, patients won't be able, will not be feeling the pain. Those are some other treatments for pain, and those are the references that I have used and questions. Thank you very much. What questions do you guys have for me?
Mark, I missed quite a bit of your presentation. I didn't get the link till late. Um, I have full body um, pain from my shoulders all the way to the tips of my toes. Um, so it's a constant pain that I have, during the day, through the night. I do take a regimen of gabapentin throughout the day, um, but there are times that the pain is so intense that it's hard to function. Um, you know that happens from time to time. Um, so it's so intense that I just I can't even do anything. I just basically need to lay flat on a bed, and um, so I don't know if you have any suggestions for me, because I do typically try to stay active. Um, so I don't know if you have any suggestions for me.
Okay. So, have you seen like a pain management doctor
Oh yeah,
for,
yeah.
yeah? And what they have, did they suggest anything for you besides medications?
Right. And that's what I was looking for, was something besides medication. Medication is, I would like to, lessen and lessen, but if I didn't use the gabapentin, I wouldn't even be able to function during the day. So, um, you know, they were not very helpful for me.
Mm-hmm.
Um, I am, as I caught some of your things there that was talking about, staying active. Um, I'm a very positive person. I do surround myself with, positive people. I haven't been ever to where, I'm depressed or anything, of that nature. So, those things don't, I can't speak to that. So, I guess I'm fortunate that way. Uh, but the pain, it's just very, very difficult, at times. And, I found the pain management place, they were just basically the very first thing that the doctor told me was, well, we're not going to give you any medication. And I said, well, I'm not here for medication. That's, I, I'm on medication. So I'm just looking for something besides that. If there's something out there that, um, I do meditate, I do those types of things. And, at times those do help, but not, it doesn't touch sometimes the pain. So, and like I said, I stay active to, to keep my mind on other things, but when your body is in such, horrible pain, it you just can't function at times.
Um, so unfortunately, just like you said, like a lot of the pain management doctors, that's what they say, like, okay, I'm not going to give you any more medication. That's a stigma,
Yeah,
unfortunately.
yeah,
It's a stigma, unfortunately, for a lot of them, and it's not like their fault. It's not the fault of the pain management. It's not the
sure.
fault of the patient, but it's, I think, like the doctor, he told you, okay, like maybe he was like mean to you or rude. He was like, I'm not gonna give you any medication.
Right, right,
He meant maybe like some opioid medication, because like he probably seen a lot of people who had like minimal pain abusing other and that's why it's very important for the doctor to understand what kind of patients he's dealing with.
right,
But no matter what's gonna happen, no matter what's gonna happen, there always gonna be stigma in that way all
right,
the time, especially here in Ohio. The opioid rate is increasingly has always been high
sure.
uh, during during our lifetime. So yeah, and if you go like to other states, they don't have that stigma, because the opioid crisis mostly started here in Ohio.
Yeah,
But some other techniques. Have you tried like acupuncture?
I have. And acupuncture really did help my back. Um, I found that to be, very, very good. Um, but you have to get into other therapists and things like that before they will send you to someone to do, more acupuncture. So the interesting thing was, so the back, they started with my back, and it really loosened, the tightness and the pain that I was feeling. Um, and then they tried, because a lot of my uh, pain is on the left side of my body. Um, I have it in full body, but the extreme part is on the left side of me, and it goes from my shoulder down my arm. Um, and so they were doing acupuncture on my arm, and I didn't find any relief with the arm as I did with the back. So it was,
Okay,
yeah, but I did find it to be very helpful.
okay.
Yeah.
Um, I don't know like your past medical history, so I might like I'm gonna ask you a couple of quick questions. What's
Sure.
the cause of the shoulder pain or of the pain in your upper body? What is it? What's the cause of it? Is it like what is it?
Well, I had my I'm a C3, 4, 5, and 6.
Okay.
Um, so I had a spinal cord injury 7.5 years ago, and the pain has just increased from the beginning to this point. So,
Mm-hmm.
and I can tell you, at the beginning, they started me on 100 milligrams a day of gabapentin.
Mm-hmm.
I am now on 800 milligrams 4 times a day. That's how much it's increased.
Mm-hmm.
And I have been trying to, through exercise and doing all the, meditation and, those types of things, I've cut myself back, one gabapentin. So, I'm doing 800 milligrams a day. So the pain is all coming from, you know, from that injury. So
Okay.
I don't, I've never had any doctor ever say anything specific, like, why this is the way it is, other than you have a spinal cord injury. That's what I've
Mm-hmm.
been told.
Um, do you have any like pain that radiate to your arms, like numbness, tingling sensation,
Well,
pin needles?
yeah, so my whole body, from my shoulders to the tip of my toes, I am totally numb and tingly. So I don't have full sensation when being touched, except in the shoulder area. So I have been diagnosed as having allodonia or allodynia,
Uh-huh. Yep,
that's
Alodon.
pronounced.
Yeah.
Um, so the light touch, you know, from the top of my shoulder down to my elbow on the left side is, you know, if I get touched lightly, it can just send you through the roof. So,
Okay. Um,
but my whole body is tingly, numb, and you know, pins and needles, stabbing pain all day, every day.
mhm.
So,
For
but
the
the gabapentin does quell it a bit. So that is
yeah,
good.
yeah. For the allodynia, have you tried like desensitization
Yeah,
therapy?
yeah,
It didn't help.
no, and
Okay.
and we constant, you know, my wife, you know, will take and rub, you know, washcloths or different types of materials to try and desensitize, and
Mm-hmm.
it's never worked.
It's okay. How about like any injections? Have you done any injections in your
Yes.
like steroid injections?
So I've had steroid injections. I've had the surgery where they've oh my gosh, I'm trying to think of what they uh, I oh my gosh, I can't think of it off the top of my head, and I apologize to everyone. I don't want to take up all
No.
everyone's time.
So yeah, like some other techniques, just like I said, like there are like epidural injections. Those are like steroid injections.
Okay,
The radio frequency ablation, those are like new treatments. If you I'm not sure exactly what your diagnosis is, because like each diagnosis they have specific treatments.
okay,
Like for example, people with the spinal cord injuries, sometimes the epidural shots they might work on them, but they might not work on other patients.
right,
Same for like radio frequency ablation. It might work on some patients, but might not work on other patients. Same thing for like stimulators. So if you're not aware, or like if your doctor hasn't told you anything about these treatments, just bring it to his thoughts whenever you talk to him.
okay,
Tell him like I was reading on the internet, and like there could be like some sympathetic nerve block. The sympathetic nerve block are good for allodynia. Epidural injection, since you already know about it. You can tell him like I've read about radio frequency ablation. Can you explain more about this therapy? I'm interested. It might help me. Do you think that's a good thing? And you can ask him about the stimulator. Uh, Tell him like, okay, what are your thoughts about the stimulator, cervical stimulator? Do you think it's a good fit for me? So those are like good options
okay,
for you to discuss with your pain management.
okay,
And yeah, another thing like I want to say, if like you don't feel comfortable with your like doctor, psychiatrist, pain management doctors, or like interventional specialists, it's not a bad idea to go and like check a second opinion. You
yeah,
know,
right,
I don't think any doctor would mind it. Like if you come to me and tell me I want to check another a second opinion, I would be like, yeah, of course, go, because like patients are number one no matter what. So if you don't feel like okay, maybe this doctor like isn't helping much,
right,
that doesn't mean that this doctor isn't good. He's good, but maybe he's like missing something else, you know,
sure,
or maybe like he's not trained to do like other surgical procedures, for example. So yeah, just like don't be shy, or don't be like it's your right to choose, like okay, I want a second opinion, a third opinion, or
absolutely,
You know what I
Yes.
mean? Yeah.
And I
So
have. I
yeah.
switched doctors. I'm very comfortable with my new doctor, and
Okay.
but I had one appointment and then COVID hit, so we haven't been
Yeah.
able to get back together. So
Yeah.
again, I apologize, everyone. I did not mean to take up all the time.
Yeah. So another thing, yeah, I wanted to say, like for the psychotherapy, if you guys have psychotherapy and you don't feel that like he's helping or she's helping the doctor, it's fine. Like therapists in general are like kind of a glove, like one glove can fit like my hand, it doesn't fit your hand. One glove can fit your hand, doesn't fit my hand. So that's how you guys like should think about it. It's not a bad idea to check for other psychotherapists or doctors or whatever. At the end of the day, you're gonna find someone that gonna like fit for you. Um, I can like based on my experience. I mean, like I didn't. Most of my healthcare providers, I didn't feel comfortable with all of them. That's never gonna happen. But like I tried one, I tried the other one. At the end of the day, I got one that like I'm really comfortable with, uh, and like it's a fit. It's a fit at the end, just like the glove and the hand. That's how I think about it.
Thank you.
I'm sorry if I didn't like give you a like better response, but I'm just like a fourth year medical student now. I'm going into residency, but I'm doing my best. But like based on my knowledge, that's like what I know so far. What other questions do you guys have for me?
All right, well, then we will go ahead and conclude if there's no other questions. If anybody thinks of a question, you can get a hold of me and I can forward it along. And I will forward the YouTube videos of the exercise examples. So, and I know if you have social media, there's lots of YouTube videos in addition to the two that are on here. There's some accounts that do different workout exercises. I know I post a couple of videos here and there myself. So if anybody has any questions, let me know. I can find the answer or forward them on to the people that would know the answer. So again, thank you all for coming. Thank you, Bosch, for joining us and giving us that presentation. We really appreciate it. Oh, he put his email in the chat. So if anybody wants to email him any questions.
Yeah, thank you very much. I really appreciate this opportunity again, and it was a pleasure. And I'm looking forward to meet all of you in person, actually.
Yeah,
Thank you for this amazing opportunity.
absolutely. Thank you. We are all excitedly waiting, patiently excitedly waiting, if that's a thing, to meet in person.
Yeah.
So hopefully maybe next year sometime. But yeah. Next month, Dr. Kim Anderson and her team will be presenting on their DoD grant that we are helping them with. They wanted us to give them some input, so they will be our speakers. If anybody needs anything from the chapter, you guys know how to get a hold of us. You know how to get a hold of me. Thank you all for coming, and have a great night. Have a great week, great month. We will see you next month.
Thank you.